How's everybody doing today?
Doing great. How are you?
Good. Okay, so for those of you that are tuning in, so Dr. Jordan and I did a virtual talk at the start of the month, or like back in March. And it went really well. A lot of members attended. We got some questions. So we thought it would be fun to kind of do this on a weekly basis and share how we both, well, OsteoStrong and Dr. Jordan, can help everybody continue to remain healthy, especially during this time. Is there anything you want to add to that, Jordan?
That is pretty spot on.
So during this time, on these weekly talks, our format will kind of be like, I will talk a little bit on OsteoStrong and how it's good for your health and really helps you on a skeletal and cellular level. And then Dr. Jordan will also go on to speak on a variety of health topics to help our immune systems as well. So today, oh, and also if you have any questions, feel free to always put them in the chat box, or when we open it up at the end, we can, you can unmute yourself and ask a question as well. All right, anything before we get started?
That sounds good.
All right, so I just wanted to touch on a little bit today on OsteoStrong since it's our first talk like this, just to kind of give a little information on what it is OsteoStrong does and just a little tidbits and then pass it on to Dr. Jordan. So OsteoStrong really helps us on a skeletal and cellular level through our breakthrough technology that focuses on strengthening the bones, muscles, and joints. So for those of you that may or may not know the stage of the bone, at about the age 20 to 30, our bones stop growing. And then about 50 and beyond is when our bones start to become more porous. We get more holes in our bones, and that's when it starts to rub and cause a lot of joint pain, that bone-on-bone rubbing, loss of balance. It really creates like a ripple effect onto what it does for our health when our bones start to get more porous. So at OsteoStrong, we've created an adaptive trigger, which we all have, which is where your brain is your command center. It tells your body what to do. So similar to when you are really hot, your body starts to sweat as a way to protect itself. Same when you're really cold, your body starts to shiver as a way to protect itself. So based on science from the 1800s known as Wolff's Law, we are creating an adaptive response known as impact force, which goes back to when OsteoStrong was being developed and being studied based on a study in 2012 with over 2,000 individuals. They found that an adaptive response is only triggered at 4.2 times your body weight is emulated or loaded, which that is primarily known to in the hips. And that's where a lot of our members have seen a lot of their improvements, 4.2 times their body weight on one of our machines, which triggers the lower body. And you will see a lot of our members see that result. We do have 3 other machines that also help your upper body, your core, and your posture. So we target the whole body in one session when you visit us. And those have different multiples of your body weight, all meant to trigger that adaptive response. So we have a lot of members who have seen a lot of improvements, not just in improving their bone density, which is a big goal, but also in improving their muscle mass, improving, feeling like they can stand all day better without their feet hurting, less joint pain, back pain, feeling stronger when they go to the gym, and increasing all of their weights. So there's really a variety of improvements that our members see in their daily life just from doing this. In as little as a month, between 1 to 2 sessions, they'll feel some improvements like that, and then over time it just gets greater. So something that we offer that I wanted to share today too is at OsteoStrong, we have a biocharger. So I know we're all in our shelter in place right now, but before that, we were beginning to offer a lot of immune support. There's a recipe on there for immune support. And I just wanted to briefly touch on a little bit as to how that works, and then I'll pass it on over to you, Dr. Jordan.
Oh,
So,
that's good.
so we have a biocharger. It's really cool. It's big, light, and something that you touched on a lot and healing the body naturally in our last talk about the immune system. That's kind of what the body should do if we treat it properly. The body should be able to heal itself naturally if we treat it properly. So if we think about it, we go through, especially women, we can have a baby. Our bodies goes through so many different changes and what it can do, and it should be able to heal itself. So when we are getting the proper sleep, exercise, diet, nutrition, all of that helps tremendously. Now, if we're not getting one or two or all of those properly, our cells are not functioning properly. So what the biocharger helps do is kind of give our body a recharge. Um, it helps to, sorry, I'm just gonna make sure that everybody's muted on here. Okay, so the biocharger helps to um, give our body that recharge because we are indoors so much. We're not outside, we're not in the sun, we're not really grounding the way we should do. We're always in home, especially now, and we're not, we're in our cars, we're in our jobs. So it really helps to regenerate our cells and give us new healthy cells and give our bodies a charge. Similar to our cell phones, we use them all day, we put them to charge. We need to do the same with our bodies. So the biocharger helps replicate what's happening in nature to our bodies inside in this form of this light that incorporates different frequencies. It incorporates voltage, it incorporates PEMF, which is pulse electromagnetic fields, and it incorporates light therapy and sound therapy with different frequencies. So then we have, so in as little as 10 to 15 minutes, the body is naturally getting energy from the biocharger, and then and it continues to regenerate itself and work over the span of the next few days. So that's just a little tidbit on what OsteoStrong has to offer. As we keep going on with these calls, Dr. Jordan and I will keep elaborating on more things from OsteoStrong and how we can just continue together to help your bodies heal naturally and be stronger overall. Would you like to add to anything, Dr. Jordan?
I would like you to sign me up for treatment the
Yeah.
day that we are out of our stay at home.
Woo! You will be the first one in the center.
That's awesome. No, I love the way that sounds, and that was part of the reason I wanted to touch on mold today. So for those of you that missed our last call or who don't know who I am Dr. Jordan Leasure. I'm the owner and physician of North Shore Proactive Health. It's a state-of-the-art wellness clinic in the northern Chicago suburbs. I also own a supplement company, and I do wellness consulting primarily for attorneys. So I wear a lot of different hats. This time at home, I was anticipating being able to get a lot more done, but I actually have a toddler. So I'm getting a lot less done than I thought I would because I'm trying to make sure his brain doesn't turn to pudding along with the rest of us. So today I wanted to touch on mold in the functional medicine arena. Exactly what Demi was hitting on. We really focus, and I've been taking notes through this so that I can circle back to some of what you mentioned. The entire body is responsible for functioning. So when you think of having a thyroid condition or having a heart disability or even the virus that's going on right now, from an allopathic standpoint, individuals are looked at for their symptomatology, and they're looked at as an organ or as a complaint or as a symptom. And from a functional medicine standpoint, we look at the entire body. So when I take a history on a patient, I tell them to be very prepared. Their online paperwork takes about 90 minutes. And we look at a patient from what I say is from conception to current. So I take a look at what's called antecedents, and those are things that you had no control over. They were essentially the first 2 years of your life. So what was mom's health and dad's health like when you were conceived? What was your birth process? What was your birth story? Were you a vaginal birth or a C-section? Were there complications? How early were foods introduced? Were you breastfed? All of that stuff is super important in laying a solid foundation for what your health is like right now. And that can sound kind of funny to the patients that we see that are 65, 70 years old and wondering how in the world something that happened, again, 65 years ago is relevant. But I tell you, it is the foundation, just like building your house. You want a very solid foundation on your house, and you want a solid foundation on your health. So when we step past that 2-year mark, we look at what has happened, some of which you had control over, some of which were reactions, but we look at things called mediators and triggers. So mediators are some of those events that were maybe perpetuating an issue. So let's say having high stress, being in an unhealthy relationship, maybe traveling and being exposed to toxins. So some of those, again, we can control, and some of them we have no control over. And then also triggers. And triggers in disease can be happy things. Like Demi was mentioning, having a baby. For most people, that's a happy event, but that is very, very hard on a woman's body, as is breastfeeding. Breastfeeding is actually more challenging than growing the new human. So we like to make sure that for those women out there that they have a healthy feedback loop. So we're compensating for some of what you've experienced, but we're also laying a fresh, nice layer to that foundation so that you've got some healthy habits to build on. Now, why in the world would I come up with mold? So those of us that have, are considered necessary medical or necessary, I can't think of the term right now, necessary jobs, we are out in the field. So some people are still working, some people are still getting out of their home. For the majority of individuals, you are sheltered in place. Now, that probably means that you're stuck in a facility, whether that's your home, a vacation home if you're lucky and you're not in Chicago, but you're somewhere where prior to mid-March, you were only spending at most probably 50 to 60% of your time. And now you're there all of the time. So if there are toxins in your home, before, if you were exposed to them, you got out during the day, you maybe went to work, you ran errands, you went and worked out, you went to your appointments at OsteoStrong, there were other places that you were frequenting. And now with this stay at shelter in place, you are probably at home 90 to 100% of the time. And the weather in Chicagoland is not cooperating for us to get out and exercise as much as I would like. But if there's one thing that you walk away from this talk is please go outside and take 5 deep breaths. It's not a beautiful day it's windy here if you are in the Chicagoland suburbs. But please just go outside and breathe. It's one of the best things that you can do for your heart, for your lungs, and for your brain, again, during this shelter in place. So what happens when you're in somewhere that you're not used to being? We talked a little bit of biomechanics last time, and this time I want to talk about air quality and allergens. So if you are currently experiencing, and again, the stresses from the outside world are not helping, the unknown can be very scary, can be very challenging. And again, these new circumstances where if you are one of the individuals that is having to work from home, that is having to take care of other individuals in the home, and also possibly trying to teach children in the home, there's a lot of new stressors. But let's talk for a minute about what mold, what some of these allergens can manifest if we're not used to it. So some of that can be brain fog. Some of it can be irritation if you're living with someone and they're a little more agitated than usual, or even you yourself, if you find that you are having a shorter fuse. Some of that can be attributed to mold toxicity. it can have topical ramifications if you find that you're having maybe a new rash, a little bit of eczema, skin is drier than normal. All of those things, again, can be attributed to mold or allergens in the home. And, going back to the brain conditions, I've seen patients that have, been on the verge of being diagnosed with different versions of dementia because they're having difficulty remembering. They're having considerable brain fog that seems more extensive than normal. Also, respiratory, which with what's going on right now, we are all hypersensitive to anyone that's coughing, anyone that's running a temperature. Again, it's fantastic to be aware, but also know there are a lot of other things going on in the environment right now that can be contributing to those same conditions. I pulled up a list, and I'm happy, Demi, if you're gonna email the attendees after, I'm happy to share this. But knowing where to look, and maybe even, using this document as almost like a checklist and running through your home and seeing what is safe, what is not, are there things that need to be changed? And I am not an HVAC expert by any means. So, please make sure that you are using the appropriate professionals if you're having someone come in and maybe doing mold testing, or seeing how your HVAC system is working. That's known as the heart and the lungs of our home. So we want to make sure that we are circulating healthy, clean air, through this process. So if you are able to test the humidity of your home, you're looking for something in the 30 to 50 range. And if you're below that, you may experience, and even without any pollutants, you may experience some coughing because the air may be a little bit too dry for you. And on that other end, that elevated end, we may experience some exacerbation of mold growth. And so that's why we want to pay attention. So in the northern Chicago suburbs, we have basements, and they are great for extra room in our house, but they're not so great because they are often the main location of some mold growth. So my one recommendation would be check out your crawl space. If you have someone come and look, make sure that everything is sealed appropriately. And again, not my area of expertise, so call somebody in that knows. But you want to make sure that is well sealed up. Checking your bathrooms. You may notice that depending on the level of your house, if you're upstairs in a main in your master bathroom, which is usually used the most frequently, and you don't feel so great when you're upstairs, maybe there's some sinus congestion, but when you go down for the day and you're on your main level, things clear up. You may want to look, have the master checked out. But obviously bathrooms and under your sinks, how often are we investigating under our sinks? Not very. I keep, maybe a couple hair products, which I'm trying to wash my hair less and less these days since I don't know when my next color's coming. So I'm not under my sink very often. Or, maybe in your kitchen, if you keep some soap under there, and, you're washing dishes, but how often are you opening things up, looking underneath, seeing if there's a drip, seeing if there's standing water, because that's what's going to contribute to that mold growth. So take a look at some of those things. A few areas that I'd like you to take a look at are house plants. Obviously, they can easily grow mold. Be really careful what the house plants that you're using, how you're watering, things like that. Christmas trees, we don't need to worry about it right now, but during the season, were you getting sick, around the holidays? Were you a little bit more congested? That may be, because there was some mold in that real Christmas tree. Blue jean buttons. I always found this one very interesting. So they're made from nickel, which is a common allergen, and you may want to use clear nail polish over that blue jean button to prevent skin exposure, to that nickel. That's an allergen for a lot of individuals. And perfume. Perfume contains VOCs, that stands for volatile organic compounds, and that, all of those are very common allergens, similar to candles. I'm a big fan of essential oils. We use them in the office. I use them in my home. I have rollers pretty much everywhere within within arm's length. So I would recommend that you transfer over to some of that. I promise you can find a scent that is like your candle or like your perfume without having some of those toxic compounds. Look at your soaps and detergents that you're using. Those can be common allergens as well. What else? Carpet. Yeah, unfortunately, carpet, whether it is a carpet that is just laid down over hardwood or a carpet that is actually installed in the home, both can carry allergens, and possibly, depending on the age of the home, contain mold as well. So those are just a couple things I wanted to point out. And you can, like I said, run around your house. Maybe you have a little extra time since you are stay at home, and you can run through and make sure things are clean and safe. And if you are experiencing any of those, unfortunately, random symptomatology, upper respiratory complaints, a chronic cough. I had a patient that was seen by her primary care and didn't know what to do, referred to a cardiologist, referred to a gastroenterologist, referred to a pulmonologist. I think that's everybody. And nobody knew what was wrong with her. She was eventually given an anti-anxiety medication because they told her that the cough was in her head. And I ran some extensive testing on her and found that she actually had both dysbiosis, which is an imbalance in the gut bacteria, and also she had an internal mold infection. So my last piece of advice would be, if you're seeing a physician or if you're doing, there's a lot of at-home testing now. If you're doing any at-home testing on yourself and you find that you are positive for mold, you want to make sure, obviously, that you follow the appropriate protocols and you clean yourself to eradicate the mold. But also, you got to get rid of the source. So you got to take a look at the home and make sure that that's cleaned out, because if you don't, you may be feeling good for a little bit, but what's going to happen? It's going to repopulate and you're going to come down with some of those same symptomatologies again. So there's a lot, obviously, that can be said for this, but to circle back, if your body is consistently fighting mold or another one of these allergens, your inflammation response is going to be up. You're going to be decreasing the quality of those bones because inflammation is so high. So if we can get rid of some of these ancillary factors that are, maybe keeping Demi's work at bay, she can help you progress as long as you're working on some of these outside factors as well. So that's why I thought we'd talk mold today.
I love that. I love some of the topics you brought up. Like, I'm very anti-fragrance anything. So you bringing that up is like good
Absolutely.
things. I do think that's like one of the starter things to not have in your home, anything fragrance. And I'm the same way. I have roller balls around my place too, essential oils, everything. Yeah. Also too, I know a couple like non-toxic tips too, just for being at home, is like frequent dusting, vacuuming, and no shoes in the
Yep.
house, just to kind of, even like ourselves, we shed and dust bunnies and stuff. So just picking that all up so we're not breathing it in.
Absolutely.
Yeah, nice. Does anybody have any questions? You can type it in the chat box or unmute yourself and ask either one of us a question.
We were just so complete.
We were straight to the point. And also too, I mean, if mold is an issue for anybody, the biocharger has a mold recipe and a respiratory recipe and a
I like
immune
it.
strong recipe.
Well, if there aren't any other questions, I would suggest to patients that, you take a look, because there's also some overlap in allergens with food. And if you're wondering to yourself, have I been exposed to toxins? Take a look at your food and water. Obviously you have much more control right now, because I'm assuming that the majority of individuals are eating out, even though there is food delivery and takeout and stuff like that. But at least in our home right now, we are eating at home. So we have more control and we're very aware of what's in our food and water. Taking a look at your home and work environments. So really analyzing right now how you feel at home compared to how you were feeling 4 weeks ago, compared to how you were feeling 8 weeks ago. Really see what's going on there. Are you trending up? Are you trending down? Sometimes I have patients keep a wellness journal so that you can really see, because health changes happen so gradually. Sometimes you don't really realize until you sit back and look and say, gosh, I don't feel good. I'm not as happy, healthy, and energetic as I should be, or as I was, or as I want to be. So you need to be deliberate in some of your modifications, some of your changes. And now, travel and recreation right now isn't a concern. Obviously it was, and I'm hoping that it will be soon. So maybe we can can take a look at your travel and recreation activities as well. So there's a lot that goes into health and wellness. So that's why you really need to be an advocate for yourself and be proactive in your choices and in your references to what's going on.
Mhm.
I do have a question, if you can hear me.
We can hear
Absolutely.
you.
Okay. Hi, I'm Donna. So I'm very much into oils too. I've been doing oil, I do oils every night. And, but what is your thoughts on vitamins? Because I listen to Wild Health, which is a podcast, and they do a lot of vitamins and nebulizing glutathione and stuff like that. Doctor, what's your thoughts on that? Because I do IV. I do IV therapy.
Awesome.
But, I'm not doing it now because I'm over 60, and I do like vitamin C, glutathione, all the Bs, etc. I try to do it to myself every 2 weeks, but is that enough, or what's your thoughts?
So absolutely. So full disclosure, I own a supplement company.
Oh, yay.
Um,
Okay. I'll come work for you.
so, so I am a big fan of vitamins and supplements. And the reason that
Okay.
I started and so my caveat is, the reason that I started a supplement company was because the quality of supplements, for those of you that don't know, vitamins are an unregulated industry. So essentially, if you're buying anything from a big box store, if you're buying anything
Right.
online that is not a physician grade brand, you don't know what you're getting. The mail order place that starts with an A that I don't want to mention, that all of us love. I tell patients not to buy anything that is consumed or put on your skin topically from that source, because it could be somebody with a fantastic printer and they're printing, your physician grade product, and it's not really what you're not really getting what you think you're getting. So be aware, number one. Be an educated consumer is my underlying number one go-to. I myself also do IV supplements, usually when I'm not recovering as well as I would anticipate I should be, but on an everyday basis, they should be supplements. They should be just that. So my goal for patients is that they are, living a healthy life. They are eating, at least 80-20, where you're doing good stuff 80% of the time, and some of us cheat. We do things that probably aren't the best for us, but try to minimize that under 20% of the time. And then, yeah, supplements are key, because unfortunately, the quality of our food, even if you're eating organic, is not amazing. A lot of individuals that I see, at least, have comorbidities. So they have other diagnoses going on. They're on medications, which are going to be leaching vitamins as well. So it's sort of the body is a complex issue, and each individual should be doing specific things. So as a woman that is looking to, maintain or improve her health, my generic recommendations, and make sure that you speak with your physician before starting or stopping any supplements, of course, but I would recommend a high quality multivitamin, a high quality probiotic that it's a multi-strain, vitamin D, especially this time of year, magnesium in the evenings especially helping with sleep and decreasing anxiety, again, based on our current
How much
circumstances.
magnesium? How much
You know what?
magnesium?
It depends on the type of magnesium, and it depends on
Okay.
the size of the person. So you can't really tell from here, but I'm 5'10", so I'm on the bigger side, and I have a fantastic stomach. I typically recommend for my patients magnesium citrate. It helps to release a little bit of serotonin. It is not absorbed by the gut like mag oxide is. If
Okay.
patients are like constipated, mag
Mhm.
oxide is like I
Right.
call it the cheap version of magnesium. But mag citrate is what I like to relax muscles and to help with a little bit of that serotonin release before bed. So usually patients can get away with anywhere from 200 to 400 milligrams before bed.
Okay.
And they don't see a lot of GI upset from that.
Okay.
But obviously,
Okay,
if it's causing loose stools, you wanna back off.
So the IV therapy that I do is every 2 weeks enough? With the MVI, vitamin C, glutathione, complex B, B12 is what I do.
Yeah, it
And,
probably, and I would take a look at, depending on where you're going, and I don't know everybody, so, just depending on where you're going and who's prescribing and who's doing what, take a look at, do your own research. So you're taking a look at what they're putting into you, because IV therapy, is similar to what you're going to find in a bottle, where the quality of the product is very important. I used to have patients that would do IV or do injectable B12, and they did it for a prolonged period, and that was a cyanocobalamin, I believe, and they weren't seeing a lot of improvement. And then I put them on our supplement, which is a methylcobalamin, and literally within the week their energy was improved. They had clarity of thinking. So sometimes, it may be a good product, but it might not be ideal for you or your situation. And as far as timing, I would definitely, consult with your physician. And if that's what they see as far as your metabolism and that's maintaining you, then every 2 weeks might be well. Once a month is okay for some people, kind of depends.
Okay. One other question regarding OsteoStrong. So I'm over 60 and I have a Peloton, and I'm basically on my Peloton almost every day. I know.
I just got one.
I'm in pretty good shape. Oh yeah, it's my favorite. You will know from Jason. That's all I talk about at Schaumburg is my Peloton. I'm like
That's
such
awesome.
an avid, So what I'm hearing though, and I go to OsteoStrong obviously once a week. I'm very upset now because I have terrible osteoporosis. I have real high numbers, but I don't take any medication for it. So OsteoStrong was my medication. So I'm very upset about this right now. And so they're saying like when you bike and cycle and you do that it's actually withdrawing, like making your bones even less, making them more thin, more osteoporotic. Is that true? Do you know the answer to that question? Or
To be honest, I haven't heard of that. We normally do recommend that you guys exercise with OsteoStrong, like, do your normal exercise in your daily life. I haven't heard of anything like that being counterintuitive. No, and biking, I really
nobody
don't see
from
that.
OsteoStrong told me that, just so you know. Nobody from there told me that.
Yeah,
it's
no,
my son researching. He's like, what you're doing is you're making your bones thinner by working out without OsteoStrong. Obviously is a little tougher, and I can't, there's no way I could do weightlifting.
No. From a physician standpoint, and I don't know, Demi, if you expanded on this. I was taking notes when you were talking, but Wolff's Law is essentially your bones are going to grow or deteriorate based on the stresses that are put on them. So, any sort of pressure that you're doing that's making your muscles work, and it doesn't need to be purely resistance exercises. The Peloton's that's fantastic. I'm a Cody fan. I'm only on like ride 4.
Him and Hannah.
But
you have to like Hannah too.
Okay, Hannah. I'll take her. I'll check her out.
Hannah Corbin. Hannah Corbin. Yeah.
Okay, I'll check her out.
Hannah.
So what you want to be doing, again, doing some of the resistance and, getting on there, and low resistance and high spinning isn't necessarily what you want to do. If you're going for some of that resistance activity, you want to be getting the muscles working. So doing, higher resistance. So it's harder to pedal. Even if you're pedaling slower, you're engaging those muscles, and those muscles are pulling on the bones, and the bones are like, oh my gosh, I better get stronger so I don't break. And that's essentially what Wolff's Law is they start to lay down fresh, fresh bone in order to keep you strong and keep you healthy. One of the best things
Okay.
that we see in our office as far as the health of bones, and Demi, you can feel free to jump in here any second, but you know, if I can get inflammation down on a patient, and some of that is as simple as eliminating Diet Coke from their
Yeah.
diet,
Yeah.
it really, the inflammatory response is what causes a lot of the bone resorption in your age group. So getting inflammation down, looking at your inflammatory markers, you know, having your doctor run a complete blood panel that includes all of those things is going to be key in looking to see where you are and where you're trending. So that's some of the easiest advice I can give you while you're stuck at home is clean up your diet, keep a gratitude journal, stay on the Peloton,
Yeah,
and
for sure.
and manage stress during this time.
Yeah. Yeah.
Yep, sounds good.
It's very hard not to go to Osteo Strong because I hope that if they, I was, you know, I'm trying to think of every way, but like if they do open some essential places, non-essential places, in, you know, like May 1st or whatever, if they could just like say, you know, but still you can't have more than whatever amount of people. I hope that we could do like 3 at a time. 3 go in, do your thing, leave, 3 come in, you know, that kind of thing. Like we've got to try to do something to get us back because
Well, yeah,
like
we are. We'll be open soon.
I hope so. I hope so. Now that I've taken all your time, I hope my
That's what we're
questions
here
are,
for.
yeah, I'm really excited about the answers to some of these questions because especially the Peloton. Believe me, I didn't stop. Nothing will make me stop because I've been cycling for like 15 years. Not outside, always in class. So
Well,
been a long
you
time.
can find me, you can follow me. I'm online. I'm at Hot Doc Chicago.
Hot Dog Chicago, I might have
Yeah.
seen you. I'm Mama, I don't know why I am, but I'm Mama Donna 16. I have my
Okay.
birthday coming this week, so I'm Mama Donna 16.
I
I
love
like
it.
to change that because I'm a nurse. I should have some kind of nurse thing, but I don't want to be considered a nurse in today because I'm not helping.
Not
That's
practicing.
sad
That's
too.
okay.
Yeah, yeah. I retired, so yeah. Well, thank you so much.
That's awesome.
Thank you.
you.
All right, I didn't see any more questions pop up in the chat box. I know we just have a couple minutes left, but this was fun for our first kickoff. I'm glad to
It was
do
awesome.
more and have different topics and more people. I see one question pop up from, do you have a question, Carmen, or is that just, I'm not sure. I haven't seen that signal before.
Oh, I saw. Yeah, I got a question, a private question.
Okay. Okay.
Cool. Yeah, and if anyone has, if there's anything that I can ever answer privately, you can feel free to email our office. It's info at drleasure.com, and that's drleasure.com, and that's also our website, drleasure.com. Just make sure you spell it right, because last I checked, Dr. Leasure spelled like happy is a nude beach. So who knows? Maybe that's like a 2-for-1 there, but it's our last name is Leasure. So it's our website, it's our email, and if there's anything I can ever answer, feel free to reach out. Or if you have a Peloton and you want to find me, Hot Doc Chicago. That's also my Instagram.
Chicago. And I'm Mama Donna 16 Chicago, so you'll see because there's a few mamas out there. Yeah.
We'll all connect. Keep each other
Yes.
accountable.
Yes. Yes.
Perfect.
Thank you.
Okay. Well, thank you, everybody. And we'll see you next Monday, same time, 12:30. And we'll see you then.
Share with your
you.
friends. Bye-bye.
Bye, bro. Thank
Bye.
you. Bye-bye.